One other thing I'd like to mention is that we on Friday stood up a formal convalescent plasma program. We have a great deal of enthusiasm for that. There are some reports that this is of benefit to patients in other countries who have had the COVID-19 virus. And what this means is taking plasma from patients who've had the virus and who have recovered and transferring the immunity, the immunoglobulins, if you will, the immunity from that person to someone who's sick. And we're hopefully expanding that across the country. The Red Cross is involved in that program, and I think it shows a great promise. It needs to be studied like other things, but just like I said before, it provides hope. We don't want to provide false hope, but definitely hope. Thank you. So this is a situation where someone who's recovered from the virus, doesn't have the virus in their system at all, you can take plasma, and this is a pretty routine procedure. You can actually donate a couple times a week, a couple times a month, frankly, and give that plasma. That plasma contains the proteins in the blood that have the antibodies against the virus. You can take that, process it, and then give it to someone who's ill. And so that allows you to transfer that immunity. It doesn't have to be matched by family or anything like that. Since last Tuesday, the Tuesday before last, we've allowed academic centers and other laboratories and hospitals around the country to do this on a compassionate use basis. What we did was we pulled this together in what's called an expanded access program and run it through the Red Cross because they've got the greatest system and capacity for doing this. And this allows us to scale up so that when people get sick, we can actually have these donated plasma packs given to the patients who are sick. So we've started with the Red Cross in this program. We made an announcement yesterday. We are planning to actually scale that up, and we'll have more information this week because we want to make sure we have the systems in place. It's a superb question.
Definitively. And I hope they use the hydroxychloroquine, and they can also do it with Z-Pak, subject to your doctor's approval and all of that. But I hope they use it because I'll tell you what do you have to lose? In some cases, they're in bad shape. What do you have to lose? It's been out there for a long time, and I hope they use it. And they're going to look at with doctors, work with doctors, get what you have to get. But we have it stockpiled, and we have a lot of it, and we're getting more of it. And as I told you, I spoke to Prime Minister Modi. We're getting more of it, but we have a lot of it. And I hope they use it because it's been used for a long time, and therefore it's passed the safety test. FDA has been terrific. Dr. Hahn, I appreciate it very much too. But I've seen some results. Now it's early, I guess. It's early, and they should look at the lupus thing. I don't know what it says, but there's a rumor out there that because it takes care of lupus very effectively, as I understand it, it's a drug that's used for lupus. So there's a study out there that says people that have lupus haven't been catching this virus. Maybe it's true, maybe it's not. Why don't you investigate that? And there's also other studies, with the malaria, that the malaria countries have very little people that take this drug for malaria, which is very effective for malaria, that those countries have very little of this virus. I don't know. You're going to check it out. But I think people should, if it were me, in fact, I might do it anyway. I may take it. Okay? I may take it. And I'll have to ask my doctors about that, but I may take it. Yeah, please go ahead.